Hey folks, this is Jason Burns with Athletic Solutions of Punta Gorda. Today what we're going to do is we're going to go over 3 special tests. It's a cluster of tests that we do to determine if there is an ACL injury. So the first one is called the anterior drawer test. We have our patient supine on the table and the knee is flexed to about 90 degrees. With these tests we want to go ahead and always test the unaffected side first and then compare the injured or the affected side second. And that's going to give us a good indication, when we compare the size and compare the amount of movements. So for the anterior drawer test, we have our patient has their foot flat on the table, and we're going to go ahead and fix it, creating a closed chain. You can sit down on it. You can go ahead and press your knee across it. We'll take our thumbs and we're going to palpate the joint line medially and laterally. Find our joint line. Our fingers are going to wrap around to the posterior side. We can palpate our tendons that attach down there. And we're grasping the posterior aspect of the tibia, and all we need to do is just use an anterior force of the tibia on the femur. And if we have an ACL tear, what we'll see is this tibial plateau move forward on the femur. We'll compare that to the unaffected side, and typically if we get a translation of more than 2 millimeters, it's indicative of an ACL tear. The next test we'll do is called the Lockman's test. So our patient will, can you slide back just a little bit more for me? Perfect. All right, we want to be in about 15-20 degrees of extension. Okay, the foot no longer needs to be planted firmly on the ground like that, flat on the ground. We'll take our hand, wrap it around the medial side of the tibia. We'll use our other hand to fix the distal end of the femur, and we'll just go ahead and do some quick upward or anterior movements on the tibia. And again, we're looking to see whether or not our tibial plateau displaces anteriorly on the femur. And then the final test that we're going to do is called the pivot shift test. So we'll bring our patient up to about 90 degrees of hip flexion, 90 degrees of knee flexion. We're going to go ahead, you can take a grasp this way and rotate the tibia medially. The grasp that I prefer to use is go ahead and wrap the arm on the underside, and then with my more proximal hand, I'm going to push the tibia in a medial rotation. Then we're going to start at hip flexion, keeping the medial rotation throughout the movement. And we'll bring it down into extension and back up. And what we're looking for here is at about 20 to 30 degrees, we'll get a clunk of the tibia subluxing and then returning back, falling back into place. And there would be a clunk right about there. Our patient shows no signs of knee movement as compared to the unaffected side. So we are negative for an ACL injury. Thank you very much.